Subjective data, part 4 of 4. Social history. Following family history, the provider should document the patient's social history, including the nutritional history. Social history should include the patient's marital status, highest level of education, and use of alcohol, tobacco, and recreational drugs. Other items can be included, such as sleep habits, exercise habits, and religious preference. In obtaining this information, it is important to be concise and summarize the pertinent points in order to individualize the patient's plan of care. Hence, although a patient may exercise daily and do a number of different types of sports or exercises, a brief summary of the patient's exercise pattern is all that is needed. For example, unless the patient is presenting for a sports-related injury, it is sufficient to state patient exercises for 45 minutes 3 times per week. If the patient's history indicates that he has a limited income, poor housing, and no running water, these details belong in the written social history because they may have a direct impact on the patient's plan of care. Nutritional history can be documented as a summary statement and does not need to include a 24-hour recall unless nutritional status is a pertinent problem for the patient. For example, if a patient is homeless and has an open wound that has been healing poorly, then a more complete documentation of that patient's dietary intake may be appropriate in order to document her or his need for further assistance or social services. Review of systems. The next broad category under the subjective findings is the review of systems. Within each system, the clinician should document the data that were sought, including pertinent negatives. The term "no significant findings" or negative should be avoided. Such forms of documentation fail to provide any specific information as to what was asked or not asked. Also, fully describe any positive findings. For example, if the patient's chief complaint is a cold, but the review of systems reveals he or she has a history of asthma, the clinician should determine how many years the patient has had asthma, what seems to trigger the asthma, how the attacks present themselves, what makes it better, what makes it worse, and when the last attack was. Which systems are explored is determined by the patient's chief complaint, list of comorbidities, and whether the examination is a comprehensive history and physical or a focused history and physical. For a comprehensive examination, all the systems should be appropriately explored in the review of systems, and for the focus examination, only those systems pertinent to the history of present illness and past medical history are explored. Determining which systems are explored in the review of systems is an important clinical decision that guides the remainder of the physical examination and the documentation process. The review of systems represents the end of the subjective component of the SOAP. Thank you for your attention.